Good morning, ladies and gentlemen. In the next few minutes, I would like to introduce you to my research topic about the COVID-19-associated multisystem inflammatory syndrome. My name is Adrienn Lukács, and I am a junior investigator in the program of Translational medicine. I'm a physiotherapist, and during the next years, my mission is going to be to improve the pediatric physiotherapeutic care. To reach this goal with my researches, I would like to provide scientific and profession-specific information. We are conducting 3 different studies to assess the main fields of the MISC. The first one is about the prevalence and characteristics of cardiovascular abnormalities among MISC children. 3 to 6 weeks after COVID-19 infection, children can develop a multisystem inflammatory syndrome. Its overall incidence is about 300 for a million of SARS-CoV-2 infections. The biggest problem with this disease is that more than 75% of these children will experience some kind of cardiovascular involvement during their clinical course. This can be, for example, a myocarditis or laboratory parameter elevation or aortic aneurysm. Luckily, most changes are normalized at discharge, but sometimes they can remain and become long-term morbidities. As a physiotherapist, it is really important to know whether if we should expect any kind of cardiovascular problem or not, because it will influence the whole rehabilitation process. We are looking for those children and adolescents who are under the age of 21 with a previous COVID-19 infection and a previous or ongoing MISC. We conducted a systematic search with the search key and got about 200 eligible articles. Now we are in the middle of data extraction, so I would like to show you some preliminary results. We have 25 outcomes, and I would like to present you 4 of them. The first one is the need for ECMO use, which is a cardiac and respiratory support in severe cases, the incidence of myocarditis, which is a common complication of this disease, and the level of troponin T and the level of NT-proBNP, which are highly sensitive markers of the cardiac damage. About the need of ECMO use, we included 19 articles with a frequency range from 0, So with a frequency range from 0% to 29%, and got for about 2,000 patients an overall incidence or frequency about 2%. I have to note that we have a high heterogeneity in our population because we included patients from newborns to 21-year-olds and also included those who were added also in a general hospital ward or an ICU. And we also added those patients who developed several conditions beside the MISC. For example, in the last cases, acute kidney injury or acute heart failure, or who were decased during their hospitalization. About the incidence of myocarditis, we included 13 articles with a frequency range from 2% to 60%. We have a high heterogeneity, and that's the reason. The reason is because we included super-selected populations. For more than 1,000 of patients, we get an overall incidence about 17%. About the troponin T level, we included 5 articles, and for more than 100 of patients, we got a mean result about 53.91 nanogram per liters, which is almost 4 times higher than the normal ranges. I have to mention the last article in which they provided information about ICU-admitted children from India. In this article, all of the other baseline parameters were elevated, for example, the level of D-dimer or the level of ferritin. And we are curious, and we would like to get in contact with the author to have an explanation for this. And about the last outcome, we included 6 articles. For 266 patients, we get an overall almost 5,000 picogram per milliliters. With a high heterogeneity, it's a notable difference from the normal values. The same situation is about 2 last outliers. They are from the same article which I mentioned previously, and in which case we would like to get in contact with the author. As a summary, this is the first very detailed systematic review and meta-analysis about cardiovascular complications in the case of MISC. We also have a high patient and outcome number to analyze. As a limitation, MISC is a very new disease, therefore we had to include different study types. For example, registry analysis or cohort studies, conference abstracts, and the articles may not contain all the relevant laboratory and medical data to use. And also these articles used at least 3 different diagnostic guidelines. As an implication for practice, the incidence of myocarditis and other cardiac complications are quite high, therefore we recommend early cardiology consultation. NT-proBNP and troponin T levels should be measured from admission to discharge in all cases following the recommendations of the diagnostic guidelines. As an implication for research, we need more predefined and same protocol studies to have comparable data and to find those laboratory and imaging factors which can predict the severity of MISC. As a conclusion, we can say that children with acute MISC have a broad range of cardiac findings. Therefore, we suggest cardiac monitoring in all cases because it's an essential part of our treatment. The level of NT-proBNP and troponin T were high in all of the articles. And we need further investigations to find those associations and causal relationships which can predict the severity of MISC. My second project is about the inpatient and outpatient physiotherapeutic care among MISC children. It's an international and multi-center survey. MISC is very new and unknown. Although it has some similarities with Kawasaki disease and macrophage activation syndrome, we are now in the phase of uncertainty. And that's the reason why we would like to give an expert opinion on this topic to assess the similarities and discrepancies among national and international hospitals and to say that what the others do and why. It's a self-developed questionnaire with the following structure. We are looking for information about the level of knowledge, the level of experience of the PTs, and also the used devices, the used methods, and the used exercises, and so on. And our last study is a retrospective single-center chart review and a prospective non-randomized cohort analysis. More than 60% of these children will need an ICU admission during their hospitalization, and we know the side effects of the bedridden periods and also the mechanical ventilations. That's the reason why we would like to compare the results of those children who were diagnosed, hospitalized, and cured 1 year before with MISC to those who are the general population. We are expecting that their physical performance will be weaker than the general population. We include those patients who were hospitalized in the Hungarian National Pediatric Institute between October 2020 and May 2021 with the diagnosis of MISC based on the diagnostic criteria of World Health Organization. The comparison group is those children who are under the age of 19 without previously known SARS-CoV-2 infections. We have 9 outcomes, which are the following. They are non-invasive standard physiotherapy tests to measure the physical capacity. As a quick overview, with the results of these studies, we can comprehensively assess when and how can a physiotherapist help to these children. Thank you for your attention, and my favorite quote is from Confucius: "The man who moves a mountain begins by carrying away small stones." Please feel free to ask if you have any questions.
You mentioned that you investigate 25 outcomes. Can you please list some of them?
Yes, thank you for your question. So we are collecting a lot of outcomes to make a detailed meta-analysis. We are collecting ECG abnormalities like ST elevation or depression, cardiac arrhythmias, also echocardiographic findings like mitral or tricuspidal regurgitation. Ejection fraction, one is our primary outcome. We would like to assess the incidence rate of the pericarditis, pleural effusions, and also the pericardial effusions.
I was just wondering that in connection with your second project, the survey, what kind of platforms are you using?
Thank you for your question. We started developing a Google Form platform or using a Google Form platform because it is open access, easy to use, and also most of us are known this platform.
This is another very, very nice study and great advance, I have to say. I mean, so far, I mean, all of them were just very good. My question is that in your own research, your own study, that you will have a control group.
Yeah.
I mean, control is always very difficult. I mean, so you just say one word, under 19, that it may not be enough. So actually, what kind of control of this, so just to make sure that this is really age matching? And actually also, I mean, that's a question of philosophy, whether they have different diseases or they are completely healthy.
Discussion is under discussion with our statisticians, and we would like to define the exact number of the needed control patients. We will include the age, the male, the gender. Also, we will include those patients who didn't have a previous positive PCR or antigen test, and we will include every patient with other comorbidities to have a general comparison group.
I was just wondering that what is your experience? So are physiotherapists actively involved in the treatment and in the care of these children? I mean, in Hungary, for example.
We would like to transform the current practice to be more involved. That's our plan. Yeah.
Okay. Thank you.
Thank you.
I have just a quick comment. Based on Agoston results, I think we should think about the control group. So maybe put a control group with asymptomatic children and not just totally healthy control without any proved post-COVID, or I mean, you know, so without COVID infection.
Thank you for your comment. Yeah, we talked previously about this, and that can be an option too, but we are worrying about what if these asymptomatic children will experience some kind of long COVID symptoms.
It's just an idea to consider it, because I think the effort will worth. So.
Yeah. Thank you. Or it can be another comparison group. Thank you.